Hi, I'm Dr. K. Paul Stoller. For over 30 years, I've treated patients with complex, frustrating symptoms that conventional medicine often misses: chronic fatigue, brain fog, unexplained pain, rashes, digestive chaos, anxiety, breathing issues, and more. If you've been bouncing between doctors, told it's just stresses are all in your head, you're not alone. Many are suffering from Mast Cell Activation Syndrome, MCAS, and they don't even know it. Even worse, it's often triggered by hidden environmental toxins like mold or persistent infections like Lyme disease. Your mast cells are part of your immune system's alarm system. In MCAS, they become hyperreactive and release inflammatory chemicals at the wrong times. This creates widespread, unpredictable symptoms that can affect almost every part of your body. It's not always obvious allergies. It can look like flushing, hives, or swelling, gut problems that come and go, heart palpitations or blood pressure swings, brain fog, headaches, or mood changes, fatigue that never lifts, joint pain or muscle aches. Sound familiar? MCAS rarely happens in isolation. It's frequently triggered by mold and biotoxins from water-damaged buildings, chronic infections like Lyme and Co., infections, other environmental exposures, or even fungal issues. I know this personally. Years ago, I developed a fungal lung infection. I started slipping into full-blown MCAS symptoms until I treated the fungus with itraconazole. The cascade stopped. This pattern repeats in my patients. I often experience what I treat, which gives me deeper insight into how to help others. It feels like a curse at times, but it's become a gift for better care. If you suspect MCAS or hidden triggers, ask your doctor about these important markers. Many are specialized and best interpreted by practitioners familiar with chronic inflammatory conditions. C4HS, signals complement system overactivation and innate immune response, very common in mold illness and chronic infections. MMP9 indicates breakdown of tissues and the blood-brain barrier. High levels explain brain fog, pain, and inflammation leaking into tissues. VEGF reflects vascular issues and poor oxygenation. Often elevated early in these syndromes, MSH, alpha-melanocyte stimulating hormone, regulates inflammation and many body functions. Dysregulation is a hallmark of biotoxin illness. TGIF1, related to TGF-beta signaling and fibrosis/inflammation pathways, can point to deeper remodeling issues. These tests, when elevated individually or together, help paint a picture of chronic immune dysregulation rather than just anxiety or isolated allergies. The good news? Once you identify the triggers, whether mold remediation, treating infections, antibiotics, antifungals, or integrative approaches, or stabilizing mast cells, the symptoms often improve dramatically. I've seen it repeatedly in practice and in my own body. Treatments may include binders, mast cell stabilizers addressing the root cause, and supportive therapies like hyperbaric oxygen when appropriate. Important: this is not medical advice or self-diagnosis. Work with a knowledgeable practitioner who understands SIRS, MCAS, and environmental medicine. Start with a good history of exposures and these targeted labs. If this resonates, share it with someone struggling. You're not crazy, and you're not alone. Healing starts with understanding the real cause. Subscribe for more on chronic illness, Lyme, mold, and practical solutions. Comment below with your experiences. I look at every comment. Stay hopeful. Real answers exist. This is Dr. K. Paul Stoller. Thanks for watching.